Welcome, everyone. I'm Stephanie Friedhoff. I'm a professor of the practice here at the Brown School of Public Health, and I'm excited about our media advisory today with Dr. Ashish Jha, our dean. Before we talk about all the amazing developments in children 5 to 11 vaccinations today, how it affects schools, other questions you may have about the pandemic response effort, I wanted to share a couple of housekeeping notes. Please rename yourself in your Zoom window with your name and your affiliation, the station or media outlet that you work for. That will be super helpful to us. When you ask a question, please unmute yourself and then obviously mute yourself again. And you can use the raised hand function to let us know that you would like to ask a question. This call will be recorded, and if you would like to record on your end, please reach out to Matt Moore, who's on this call, by chat, or just post it in the chat or reach out to me, and we can give you permission to do so. You have permission to post parts of the recording online or use them on the air. Please just don't use the whole call, right? A maximum of 10 minutes would be great. And we'll be starting today with an introduction by Dr. Jha, and then we'll be diving right into questions. And with that, I'll hand it over to Ashish.
Great. Thank you, Stephanie, and good afternoon, everybody, or good morning, I guess, still, if you're on the West Coast. Really happy that people could join today. I thought it'd be useful for us to spend a few minutes together because so much is going on right now with COVID, and I feel like we're at a really important moment in the arc of this pandemic, where we really are starting to shift, in my mind, towards what really should be much better days ahead, with still some bumps, still some challenges ahead of us. And I want to take a couple of minutes to talk specifically about what has happened over the last week with vaccines for kids 5 to 11, what the evidence is, why I think both the FDA Advisory Committee and the CDC Advisory Committee voted unanimously. I know there's one abstention on the FDA Advisory Committee side, but if you look across those, there were 31 votes in favor and one abstention, really because the evidence here is really very clear that kids 5 through 11 benefit from the Pfizer vaccine. I'd laid out some of the arguments for why I think the advisory committee voted the way they did in a Time magazine piece I wrote over the weekend, but I just want to take a minute to highlight that despite all the misinformation that we often hear about kids are not at risk, the real issue is if you compare the risk of COVID compared to other risks that children face, this is a serious problem. And it is a problem for which we now have a highly effective, very safe preventive measure, and that is a vaccine. And therefore, in my mind, it really is not a close clinical call. I think every child in America 5 to 11 should get vaccinated. I think every child 12 through 17 should get vaccinated. The evidence on all of this is very clear. The couple of issues that I want to just quickly address on 5 to 11, really the biggest one that has concerned people is the issue of myocarditis. Myocarditis is a reaction that we see in about 1 in 10,000 children between the ages of 12 and 15. That's been the kind of best estimate that we have. All of the data suggests that those are relatively mild, certainly compared to myocarditis that you get from infections. It's different mechanism-wise, and it is self-resolving. And every bit of what we know about vaccine-induced myocarditis should make us feel like the rates are going to be much lower in 5 to 11-year-olds. We don't know. The clinical trials didn't identify anybody, and that's not a surprise, of course, because the clinical trials only had about 2,200 kids who got the Pfizer vaccine. But it's a lower dose. It's in prepubescent boys. We think boys are much more at risk. And so even if the risk was as high as it is for 12 to 15-year-olds, you'd still be worth it. But I think most of us should feel very confident that the risk of myocarditis is going to be much, much lower in this population. Combine that with all of the other safety benefits, the clear efficacy of 90%, and it is no surprise that both the FDA Advisory Committee and the CDC Advisory Committee voted unanimously in favor. And then, of course, Dr. Walensky signed the CDC authorization, and the vaccines are now getting out. My expectation is the next few weeks, it's going to be hard to get vaccines because there's a lot of pent-up demand. About 35% of American parents, including me, are very excited to get their kids 5 to 11 vaccinated. That's, probably about 9-10 million children. And it's going to take a while to just get all those kids their first shot. And then then the hard work is going to begin of pediatricians, family practitioners, nurse practitioners really having those conversations with parents, with families about the value of vaccinations. I remain confident that we're going to see reasonably high vaccination rates in this population, but it's going to take a little while, and certainly will take a few weeks or even a few months before we get into high levels of vaccinations for this population. Let's talk a little bit about what the implications of all of this are. And then I want to just also take 2 minutes to talk about kind of what's happening nationally beyond children. As these vaccines begin to get out, it will, I think, have a really important impact on schools. Now, schools have largely been open. That's terrific. We still continue to have too much quarantining and kids getting pulled out of school because of infections. I think that's a problem. At this point, we have all the tools necessary that we don't have to pull kids who've been exposed out of school. We can let them continue to be in school using methods like test and stay. But then once you add vaccination in for all school-age children, it becomes a very different situation where between adults being vaccinated, kids having the opportunity to be vaccinated, at some point, I think we can begin to think about pulling back on some of the other restrictions we have. Obviously, the one that's the most contentious is mask mandates. And I believe that once vaccines are widely available over the next couple of months, being able to pull back on the mandates for masks is going to be very, very reasonable. Kids can continue to still mask if they're in high-risk groups. The availability of high-quality masks means that people can protect themselves quite effectively. And I suspect that certainly masking during times when people have symptoms, maybe when there might be a large local outbreak, would all be reasonable. But I think in general, the mask mandates that we have seen across the country will begin to get pulled back, and I think it'd be reasonable to do so. But the bigger picture point is, with large-scale vaccination of kids, we really can get back to what I think is a new normal, a relatively good normal, where sports, activities, all the things that are so important beyond just being in the classroom should really resume in a way that looks a lot more like 2019 than it does what life looked like in 2020 or even early parts of 2021. So that's good news, and I think that is coming sooner rather than later. Let me just take a minute to talk about where we are as a country. The good news has been that the Delta wave really did peak at the end of August, early September, and has had a nice steady decline down, peaking at about 150 to 160,000 infections. It has come down to about 70,000. And then over the last week, really for the first time since that decline began, we've seen a real plateauing. The infection numbers have been about 70, 75,000, 7-day moving average over the last 7-8 days. And it is possible that it is just a pause before it declines further. I suspect it may not be. I suspect that we may be plateauing at a reasonably high level, or we could even see infection numbers start climbing back up again. What do I think is going on? What's going on is the weather. In the northern half of the country, it's getting pretty chilly. Here in New England, it was in the 30s when I woke up this morning. And this is what we expect in early November. And obviously, it is only going to get colder. And we also know by the seasonality of coronaviruses generally, not just SARS-CoV-2, but other coronaviruses, that they really take off in October, November, December. Those are the most active months for human coronaviruses. And so I think what you have is seasonality, weather, people spending more time indoors, running up against highly vaccinated populations. So whereas last year between October and November, we saw this huge acceleration of infections, I don't think that's what's going to happen. We are going to see a plateauing. And the last point is, I think we're going to see a split. In New England, where I am, the states are very, very highly vaccinated, with 70% of the population fully vaccinated. You're going to see more vaccinations coming online as kids get more vaccinated. I think New England is going to stay relatively flat, or might even decline further despite the weather. In the Great Plains states, in the upper Midwest, where vaccination rates are lower, both already case numbers are higher, and I expect more concerns in terms of what's going to happen in the next couple of months. Again, I don't think we're going to repeat the performance of the fall and winter of 2020, just because there's so much more immunity in the population. But I worry that there are states in the US that still are not out of the woods and may face some difficult months ahead. And then finally, just to finish off, I want to take a moment, just talk about the global scene. Global vaccinations are continuing. China has administered about 2.2 billion doses. India hit the 1 billion mark recently. Much of the world is kind of cooking along. The big problem of global vaccination remains Africa, which has less than 5% of its population fully vaccinated, about 7-8% with at least one dose. And we have all got to do a lot more across the world, from high-income countries like the US and Europe to India, which is now starting to get to a point where it's starting to have more vaccines than people certainly will in the next month or two, that we've got to get a lot more vaccines to the African continent and make sure that we've at least vaccinated all the high-risk people and ideally the entire population. I'm optimistic about global vaccinations in 2022, but we still have work to do, especially on the continent of Africa, but some other lower income countries as well. So let me stop there. There's a lot of ground to cover. I know you guys have a lot of questions. I see hands up already, and I'll let Stephanie moderate the questions, but thank you all for joining me today.
Thank you so much, Ashish. Again, please use the raised hand function, which you can find in the reactions at the bottom of your screen. And our first question today is from Brenda Goodman from Medscape.
Hi, Dr. Jha. Thanks for doing this. I have a question about, I wonder how you feel about mandating Pfizer's vaccine under an EUA for school attendance. And then a second part to that question, we have a large school district in Metro Atlanta where I am that has already said they're going to roll back masks 1 month after the vaccine becomes available to kids. So the clock is already ticking on that. Does that kind of a policy make sense to you?
Yeah, so let's talk about vaccine mandates for kids. I've already been asked this a few times publicly, and I've said I don't think it makes sense to have a vaccine mandates for 5 to 11-year-olds right now. Look, when we did and it's not the EUA part to me that's such an issue, but when you think about when we did vaccinations for adults back in December, we did not have vaccine mandates immediately. We let people choose to get vaccinated or not in the early months. We really built up a lot more experience. And the earliest vaccine mandates you really saw from individual private organizations, public entities like governments, didn't really come for about 6 months or so. That's how I envision what should be happening with children right now, is let kids get vaccinated, give parents time to have those conversations with their pediatricians, let people get comfortable with this. That takes some time. If you've been listening to me publicly, I'm pretty pro mandates in specific circumstances. I don't think that's what I would do. I actually do not think that's what we should be doing right now for kids 5 to 11. Kids 12 to 16, we've had more experience and spend more time. Under specific circumstances, I think that it may be reasonable. But I think as a precondition for schools, it's also it's not necessary for it to be a precondition for school attendance. In terms of mask mandates and timelines, as I said, I think it's really about availability and when there's been enough time. A month is not enough. Even a child that got vaccinated today is not going to be fully vaccinated in a month, because it's 3 weeks between doses. And then you need 2 weeks after that to be fully vaccinated based on CDC criteria. And obviously kids are not all going to be able to get vaccinated today. There's a long line and places are not quite ready. And so I understand that some school districts may want to move quickly on this. And what I would say is give parents time to get their kids vaccinated. And if we do that, it's going to be a much more reasonable to pull back the mask mandates down the road.
Thank you. Next question is from German Lopez from Vox.
Hi, thanks for doing this. So I had a question about boosters for you, which is just like one of the things I've been wondering is just what unanswered questions people have about them. I mean, what are some of the, like starting with, for example, what is even the point of a booster strategy if we follow one? Like what exactly are we trying to accomplish? So anyway, along those lines, I'm just curious, what do you think are some of the major unanswered questions around booster shots, and speaking specifically for adults here?
What are the unanswered questions, Herman?
Yeah.
Well, there's a lot. So I'll tell you what I think is really clear in my mind on boosters based on all the data we have. It's really clear to me that certainly people over 40 benefit from a booster 6 months out. And that's not what the CDC and FDA have done. They've obviously done over 65 or chronic disease or high exposure work. But there's plenty of evidence, I think, emerging from other countries that people in their 50s, people in their 40s benefit. One of the questions that's not as clear, remains unanswered to your question, is what about young, healthy people? And we just don't know. And we don't know. And I can speculate what I think that will land, but I don't love speculating. I'd love to see the data. And I think that remains an important question. Should a 25-year-old healthy person who got vaccinated 6 months ago, should they be getting a booster? We don't know the answer to that question. The second big question we don't know the answer to, of course, is what are the long-term benefits of a booster? How long does it last? Will we need another booster a year from now? Will we need another booster sooner than that? Again, there's some reasons to believe immunologically that once you get a booster 6 months after your second shot, that should have a lot more durability than the first 2 shots did. Can't prove that. We don't know for sure. We don't have that long-term data. That's, I think, a really important question. But the benefits of boosters for the high-risk groups, people over 40, people with chronic disease, 6 months out, to me is really pretty clear. And so while I appreciate where we are with the country, with our country in terms of getting high-risk people boosted, my guess is we're going to be expanding that to include more people, certainly people in their 40s and 50s.
Excellent. The next question is from Rachel from AARP.
Hi, thank you so much for doing this. We've been hearing recent reports about a Delta Plus variant popping up in the UK and now the US. I'm wondering if you could talk a little bit about what we know about this strain and whether it's something we need to be concerned about as we're heading into the colder months, like you mentioned, and especially, still considering only 58% of the population is fully vaccinated at this point.
Yeah, it's a really good question. So Delta Plus first popped up in India June-ish, I can't remember, but somewhere around May or June. And it sort of sputtered out and didn't do anything. And so I think people were initially worried, and then it really looked like it wasn't going to be a problem. Delta Plus has shown up in several places in Europe, in the United States, and has never really taken off. It has become more commonplace in the UK. And whenever you see a new strain kind of taking off, there are 2 potential explanations. I mean, there are multiple explanations potential, but the 2 most common ones are it's more contagious, so we worry about, or there's what people talk about as a founder's effect or an epidemiologic kind of advantage that it has, that it hit a population where the infection numbers were going to take off. And there's been a lot of work to try to sort out, is it actually more contagious? And the preliminary evidence, suggests that it may be about 10 or 15% more contagious than Delta Classic or Delta Original, right? That's an advantage. And that means that over many, many, many months, it may become the dominant feature. The differential between Delta and Delta Plus is much, much smaller than what it was between Delta and Alpha. Alpha was the one that was widespread in the United States in March, April, May, before Delta took off. So I would not be surprised if Delta Plus eventually ends up becoming dominant, but I'm not super worried about it. It's not that much more contagious. And I'm not even convinced that it is more contagious. That's what the sort of very preliminary evidence suggests. The not bigger question, but another question that's also critical is there any reason to think that it's going to have any more immune escape? And the preliminary data, and again, all this stuff is preliminary, the preliminary data out of the UK suggests that our vaccines are holding up just fine. They've tested both AstraZeneca and Pfizer vaccines, and have every reason to believe that J&J and Moderna will act similarly, that the vaccines are going to hold up fine. So I look at it and I think of this as a variant of a little bit of concern, but certainly not anything that I think represents a game changer in terms of our strategy and approach.
Great, thank you.
Thank you indeed. Next question comes from Matt Couture from WLNE.
Hi, Dr. Jha. Thanks for taking questions. Just looking forward, some of the medical experts, the medical professionals have talked now about an endemic phase of the virus now that the vaccine is going to be available for kids. My question is, for Americans to move forward, do we see a point where this becomes like a flu in terms of you're sick, you stay home, you feel better, you go back to work? Or how long does the quarantine, the mandatory quarantine last, especially with no federal money available for a lot of workers right now?
Yeah, it's a really good question, Matt. And it raises all sorts of issues because there isn't, for instance, sick leave. If you get the flu, a lot of people still feel pressure to go back to work. And of course, we know that that's not great from a disease spread point of view. And so how do we deal with that with COVID? Let's just talk about the kind of biology and public health issues first, and then I think we can talk a little bit about the policy stuff. We are in a period of time right now where we are moving slowly out of the acute phase of the pandemic that we have been in for the last 19, 20 months, what feels like a decade, towards a kind of endemic state. We're not quite there yet. We still have high levels of infection. Obviously, a lot of Americans still dying every day. But we are clearly heading in that transition. We're in that transition phase, and I'd say we're early in the transition towards an endemic state. Once the virus is endemic, there are a lot of different models out there of what that will look like from a kind of population point of view. The models that I have looked at that I sort of trust most, kind of try to factor in a few things: an endemic Delta, waning immunity among the population, booster shots being given, let's say once a year, and some amount of population at risk at any given moment, including people who've not been vaccinated or people who got previously infected and their immunity has waned. And when you put those models together, you have models that suggest that maybe 10 to 20%, maybe as much as 20% of the American people will get infected every year from SARS-CoV-2. That's 60 million people. Now, that sounds terrible, and it has real implications. We think in a typical year, 10% of the population gets infected by the flu. So why would this be worse? Because it's so much more contagious than the flu, right? This is a dramatically more contagious virus than the flu. And so once it is endemic, I can imagine 20% of the population. Even if we bring the mortality rates way, way down, because we've done a terrific job on vaccinations, we're going to have more therapies, you can still imagine a mortality rate that could rival the flu at about 0.1%. And that means we're talking about 60,000 deaths from SARS-CoV-2 a year. It's a lot. That's a bad flu season. And throw in the fact that just because you have endemic SARS-CoV-2 does not mean that the flu will have gone away. So now you're going to be dealing with two very serious respiratory infections that America is going to have to deal with. For those of us who've been practicing medicine for a long time, we know that the flu really stretches our hospitals every year. For about 2 to 3 months, hospitals are full. We're struggling to take care of everybody. And that's with the flu. Throw in SARS-CoV-2, becomes sort of borderline unmanageable. So we're going to have to make some decisions as a society. What are the long-term strategies we want? I think improving indoor ventilation is going to be a really important part of that strategy. I think really changing the culture of, somebody's super sick, but boy, they're tough. They're going to come into work anyway. We used to love that and be like, that guy is a real trooper. Now we're going to say, oh, that guy's a super spreader, and he or she, it's not necessarily needs to be a guy, but actually needs to stay home. And we've got to have policies that support that. If we don't have those policies, we're not going to be able to have our hospitals and our healthcare system really function during several months of the year when the viruses are circulating together. So there's a lot of work to do to kind of get to a long-term stage where we're going to be able to manage 2 respiratory viruses every year moving forward.
Thank you. The next question is from Amy Birnbaum from CBS News.
Hi, thank you for taking my question, Dr. Jha. I wanted to get your perspective on the preparation, or how well the U.S. is for this actual rollout to for the 5 to 11 population. Are we equipped to really get the kind of penetration or coverage that we need? And how do you see it differing from the adult vaccination rollout, specifically in terms of venue?
Wait, I'm sorry, I didn't catch the last couple. How do I see it different from the adult rollout? And then you said something else.
Specifically in terms of like venue, like where the best place
Venue,
is
got
for
it. Yep.
a child to.
Yep, great question, Amy. So I think, first of all, I think in general, it's gone much, much better. Now we'll see what the proof is going to be in the pudding over the next couple of weeks. And I do expect that for the next couple of weeks, there's going to be some backlogs and some challenges. But if you think back to what happened in November, December, really December and January, where there seemed to be no national plan. Every state was on their own. There was all this scrambling and all of this kind of stuff going on in terms of who could cut in line where. And ultimately got better when we set up mass vaccination sites. This is the strategy here is a little bit different. And obviously a chunk of the strategy is to try to get vaccines into pediatricians' offices. I think that's right because look, I'm personally very enthusiastic and I would take my kid to a mass vaccination site. But the truth is most parents are going to feel so much more comfortable if it's in the context of where they take their kid for other vaccines. So I think that strategy is right. I do think for the pent-up demand, CVS, maybe even some mass sites may make sense for short periods of time, but I don't think they're going to be the major way that we get kids vaccinated. If we do it through pediatricians' offices and schools, it will take longer. It will draw it out a little bit more. But I think in the long run, it's probably a better strategy. And so in general, I've been pretty supportive of the approach that the administration has taken. It's still, I think for the next few weeks, for those of us who are anxious to get our kids vaccinated, it's going to be frustrating. And I expect that some number of parents are going to wish that it was going faster.
Thank you.
Thank you indeed. So I wanted to offer the opportunity for anybody who is struggling to find the raised hand to see if there's any questions.
Ernie, look, my monitor just suddenly died.
Looks like we're good. So then, Ashish, do you want to provide us with some closing thoughts?
Yeah, I would be happy to. So first of all, thank you again all for coming. This is just an opportunity to kind of, I think, summarize a few of the major issues that are in front of us. As I started with, I mean, for me, this is also very personal in the sense that we have, one child at home who is not yet vaccinated with two teenagers who are. And so I was paying very close attention to the data that was released, not as much as, certainly as a public health person and as a physician, but very much as a dad. And the data has been on vaccinations for 5 to 11-year-olds has been extraordinarily reassuring. If we put the whole package together, what we know about vaccinations for 12, 13, 14-year-olds, what we have seen in the clinical trials, I think all parents should feel very reassured that the right thing to do for their kids is to get them vaccinated against this highly contagious virus. I'm hoping that will happen. It's great to see that all the medical societies, America's pediatricians, family practitioners, everybody really strongly on board. When I talk about that national picture and the plateauing, as kids get vaccinated, kids have been part of the outbreak that we've seen with Delta. As kids get vaccinated, I do think that will also put downward pressure on those infection numbers, will make it easier to get through the holidays. I think the Thanksgiving, Christmas and the holiday season is going to look much, much better this year. Certainly any child who wants to be vaccinated over the age of 5 will be vaccinated by the holidays. And that's going to make for just a safer holiday season for everybody. So I feel like we're in a very good spot. And again, one last thing we talked less about was therapeutics. We do have one drug that hopefully will get an EUA soon, more coming. All of that means that we can begin to kind of get out of the emergency phase of this pandemic and move into a different phase where the virus is around, the virus is with us, but no longer dominates our lives. And the good news is I think we are much closer to that than we have been at any other point. Obviously, no one wants to call this too early. Delta was a bit of a curveball, and I think we still have to be careful, but we are now developing kind of more and more tools to manage this pandemic. And if we apply them effectively, we really can put the acute phase of the pandemic behind us. So thank you all for joining us today. And barring any other questions, I think I'll turn it over to Stephanie to close us out.
Well, thank you so much again. Thank you all for joining us. Let us know if you have any follow-up questions, and we'll see you in a future media advisory soon. Stay safe.
Take care, everybody.